Hi, everyone. Thank you for coming to today's webinar. My name is Ariel Scharf. I'm the Product Marketing Manager here at Hint, and I'm going to be the moderator for today's webinar, as well as give a quick demo about what a DPC wraparound actually looks like in your Hint account. We're at 4:01 my time, so Pacific time, and people are still trickling in, so I'm going to give it one more minute and see if we have some more people joining us at that time. In the meantime, I'd like to thank you all for joining. I know these days right now are long, and so we really appreciate you taking the time to spend an hour with us to learn more about our partner, Zion Health. I'm going to stop sharing my screen right now and spotlight my face. Okay, so like I mentioned, I'm Ariel Scharf. I work for Hint Health, and just I wanted to start by giving a little bit of context for why we've partnered with Zion Health. At Hint, our mission is to power direct care and make it the new standard. That means that when we select a partner to go to market with, we're always looking for a partner that adds value to our direct care clients, that adds value to the patients of direct care clients. And with our DPC wraparounds, which are complementary products to a DPC membership, we've been able to find a lot of value both for our clients and for our patients. DPC wraparounds are completely free for the practice to use. It's a way for you to offer something besides primary care to patients who may need it. In the case of Zion Health, which Nathan will tell you a lot more about, it is an affordable way to manage larger healthcare costs that are not primary care, such as hospitalizations, and it's a way to make direct care, the value proposition of direct care, just better overall. You're already providing great services to your patients, and this is one more thing that can help them in their healthy lifestyle. So with that intro, I'm going to now introduce Nathan. He is the founder and president of Zion Health, medical health share. And with that, Nathan, would you mind turning your camera back on? Let me see if I can do it for him. There we
All
go.
right.
Awesome.
There we go.
I'm going to hand it over to Nathan now. So, a quick word about format of this webinar. Nathan's going to give an overview of Zion. He's also going to talk about what they're doing for COVID-19 patients. I will give a quick demo in staging a Hint account, so you'll see what it looks like, and then we'll open it up for Q&A. However, it's possible to ask questions throughout the whole webinar. You'll see right below me, there's a Q&A button, should be right about here. If you hover over your cursor over the screen, it'll pop up. That's where we monitor the Q&A. So please don't put it in the chat. The chat won't be monitored as closely. Please put it in that Q&A. And again, all right, take it away, Nathan.
Well, thank you very much for having me and for the introduction. I appreciate it. Medical cost sharing organizations, there are many of them out there, and in general what they are is it's an organization where members share in each other's medical needs as a community. Zion Health is a nonprofit organization, and we're different than other medical cost sharing organizations through some of the things that we do differently. And I come from a experience of administration, and so we're very strong in making sure things are done very efficiently and smoothly. And we work with the providers directly. So if a member has a need where they might need to have multiple providers, or they might have just a single provider, we're working directly with those providers to make it so that we're negotiating those medical needs, those expenses, and the care for the member, so that at the end of the day that the member isn't having to play the billing game, doesn't have to worry about paying for the need ahead of time or getting reimbursements. And so that makes it really easy for the members. We're also different in the fact that we're paying medical needs quickly. We're really efficient in those payments. typically within 5 business days. And so those are some real quick things that are different, and there's actually quite a few differences in all the health share organizations. But one of the things that I wanted to point out that's different also is that we really work closely with our direct primary care providers, and we use them as a quarterback for the member's need. And our program is designed to work around it as a wraparound, as you will, to the medical cost or the direct primary care membership that they have with you. And so at the end of the day, the member is going to come to you for their direct primary care needs. And if they have a need, they work with you and Design Health to make sure that those needs are satisfied and that their care is given the proper way for that member. And so we work really closely with you, and that's something that we feel very strongly about. And so those are some real quick things that are different about Design Health, and that's something that's really exciting to us. One of the things that I wanted to mention also is our COVID-19 relief program. Our COVID-19 relief program is designed to help members or people who have needs, and we have a coupon code that you can use. It's a COVID-19, and what that'll do is give them 50% off of their member needs sharing. Rather, so if whatever their rate would be, it would be 50% off of their member needs or their sharing for 3 months. So existing members or new members are able to take advantage of that program. Existing members could call in to us and we can put that on. There's no question asked. If they're struggling, we want to make sure that we're there to help them. That's what we're here to help people, and that's what we do. So a little bit more about medical cost sharing. Medical cost sharing organizations do a lot of things to help people with sharing in medical costs. And one of the things that I want to make sure everybody understands is that we're not an insurance organization. We do not operate within the confines of traditional insurance, and that's what makes it work so well, actually. And so what I want to say is that because of these things, there's a lot of great things that we could do, including alternative medicines that we can help people with, and we could also help them with making sure that we are really their advocate in their healthcare needs, which is really important to all of us here at Design Health. Some of the things that are regularly normal with medical cost sharing organizations, I want to make sure everybody understands, is that medical cost sharing organizations, we're not different in the fact that we also have some limitations on pre-existing conditions. And so if a member has a pre-existing condition, how we work with those folks is that we accept everybody. And so if they're wanting to become a member of our organization, then they could become a member. There's no one that gets declined, and we accept everyone regardless of what their faith affiliations are, and that's something that's also important to us. The thing that I wanted to also point out is that these medical cost sharing organizations in general will have, with those pre-existing conditions, those some of them will decline completely or not allow them to share in those specific needs. We do have a phase-in process. So the first year for someone who has a pre-existing condition there would be a waiting period of up to 1 year. And once they've gone through that 1 year, we'd share up to $25,000, and then it progressively goes from there. So we give the members an opportunity to share in medical needs, even if they have a pre-existing condition. Though we have something that I feel is a great program, and this program is what we call our additional giving fund. And this additional giving fund allows for members to participate in receiving or sharing medical needs for something that's outside of the member guidelines, and that would be specific to pre-existing conditions. And so that they have something that is relatively, they need maybe a surgery in the first year, or they might need something that otherwise is needed. We're looking to find ways to help those folks who have those needs so that we can share in those medical needs and not leave them stranded, if you will. So those are some real quick things I wanted to point out, and that will help people understand a little bit about who Zion Health is as an organization, and wanted to kind of point those out as and there's a lot of differences. So I'd like to kind of leave a bit of more time on the Q&A so that people can ask some questions that they might have. But I'm hoping that at least I covered some of the general questions that you might have. So kind of one of the topics that I wanted to talk about is how do people enroll in Design Health? First off, I'd like to say that all of our members can enroll directly from our website. We use the HINT system as our enrollment tool. So if those who are enrolling through our website, they'll go into our HINT system, and then they'll be able to enroll directly. They can indicate that they're a member of your DPC, and when they're showing they'll be able to find your DPC in the drop down. I think that's something that will be shown here in a moment. That will be something that they will be able to roll right directly on the website and instantly become a member, where they'd be able to choose their effective date and go forward with that. So there's not a lot of waiting. There's not a lot of separate systems. It's all integrated within the HINT operating system. If you turn turn Design Health on to your operating system with HINT, then you will have the ability to be able to do that within your enrollment yourself too. So as the member goes through and rolls into your membership with your primary care membership practice, they would be able to then afterwards have the opportunity to add Zion Health as their wraparound as well. Did you want to take a moment and share now at this point for the demo on how to
Yeah.
enroll?
Hi, everyone. So, okay, let me share my screen. I'm going to walk through what it looks like from your end if you're in your own Hint account. Hold on, let me put my video as the spotlight. Cool. I'm going to walk through what it looks like from your end. If you're in your Hint account and you want to be able to offer Zion to your patients, there's a few ways that they can enroll. As Nathan mentioned, they can enroll on the Zion website, but the way that is actually pretty simple from your end is through, I'll show you. Let me share right now. Okay. So what we're looking at, here is your admin section of your Hint app. The way I got here is I clicked admin, and then I clicked online sign up. So when you get to online sign up, you'll see that there's a few tabs, and one of the tabs is sign up pages. So that's what we're looking at right now. What you can do is you can add, once Zion is enabled in your account, and we'll give you instructions for that later, you can add Zion to the end of one of the sign up URLs. So I'm going to select this DPC 2020 pricing sign up page. I click edit. Over here, I see that it says wraparounds enabled. You'll search and you'll see that Zion's one of the options. Save it. And now what we're going to do is start an enrollment path with this sign up page. So this is what a patient would see, a brand new member would see when they go to sign up for your DPC. So in this example, we are NextGen. The patient feels like they are enrolling in NextGen. And so one of the great things about the way we've revamped for those of you who have already used DPC wraparounds and there used to be one single sign up page for both the wraparound and your practice, one thing that we heard is that it was really confusing for the patients because they thought that the wraparound was actually part of the practice, and we really don't want to cause any confusion here. So what we've done instead is separated the enrollment into your practice from the one that they'll enroll in Zion. So sorry, forgive me for being a bit scattered in my speaking because I'm typing as I do this. I'm going to select my provider and put my bank account, credit card in. And you'll notice that this is basically exactly like any other enrollment process. You see the first bill, the recurring bill, and then you agree to the patient agreement. So now HINT's processing and we'll send you to the next page where it gives you the opportunity. You've already enrolled, the sign up is complete, the payment has gone through for your practice, and then there's a little module here that explains that you can enroll in Zion Health if you so wish. So you can either choose to get the details emailed to you, or you can enroll directly from here. One of the great things is that it pre-fills all the information that I just entered, so I don't have to do it twice. So this is the Zion enrollment page. They'll just click through, confirm that everything's accurate, and then also add, uh, ensure that the IUA is the one that they prefer. So right now, this is the plan that they've selected. They're going to sign up. And then boom, there it goes. The billing is completely separate. So they're going to get one bill from Zion, one bill from your DPC. There's not really a conflation of like where the money goes. If they cancel the Zion membership, there's no effect on your practice. Um, so that's pretty great for you guys. It's a totally ancillary product. It's not a third party. You're not doing any sort of reimbursements whatsoever. Um, Over here, I'm going to show you how to enable Zion for an existing patient. So right now, what I have pulled up is the chart of an existing patient in HINT, John Cash. I'm going to scroll down to the wraparound section, and I'm going to click Send Enrollment Email. So if the email was accurate, then the email will be sent to that patient, and the patient will then click the link and enroll in Zion. So it's pretty simple. Um, and should be a lot less confusing for your patients. And it's just another option that they can use if they want something that is ancillary product to the DPC membership. Okay, so it looks like we already have a bunch of questions. This is great. Nathan, this is for you. It says, do you work with employer groups? If yes, please provide more information about how it works. Nathan, you're muted. So, there we go.
Oh, I'm good now. Okay, yes, we do. So Zion Health allows for what we call our worksite memberships. And so as a worksite member, they're able to participate in of course, payroll deductions or however they like to have it billed. But we're able to offer that through a company. How it works, they're able to still continue to work with you as a direct primary care membership, and then of course add Zion Health as a wraparound to your existing membership with you. So very simple, very easy. We use the HINT system as well, and it allows them to continue to be a member of both Zion Health and a member of your practice. If, by the way, we have a team of folks here that can help you. If you have any questions on how to implement a group or like to have more information, we do have a zionhealth.org/DPC. We really make things easy from every standpoint. When you as a practice really don't have to go into a lot of work in teaching everybody what Zion Health is. You could just send them over to us. We have some links on our website that will allow those practices for you as a practice to submit a need or excuse me, not a need, but a request for our team to reach out to one of your members, and we could teach them all about it for you. And so we have a lot of tools there specifically designed for DPCs. So please feel free to go to that page and learn more about how we can help you and make that easy for you.
And we'll follow up with an email that has that information as well. The next question from David Cunningham is, can you go over the process that a member will go through to pay for specialty care or imaging/labs? Does the member negotiate a price with the provider? Do they pay up front and then get reimbursed? Can you just walk us through that member experience?
Yeah, the member experience is really important to us, and we've tried to make that as easy as possible. When members you become a member of Zion Health, they do get an ID card, and that ID card allows them to submit for all those medical bills, such as the lab work, whatever specialty visits or so forth, and it gives them the ability to have us do a repricing. And we use the PHAs Network for those who are familiar with that. That's the largest nationwide PPO network, independent network in the country, and that gives them some pre-negotiated rates for common services like lab work. And so what they would do is just provide that ID card to the provider, and that provider would then submit it through to us, get those negotiated rates down, and have that available to them. If those medical bills are related to a need, we just assign those medical bills to one of their medical needs that they have. Otherwise, if it's under their IUA, under their initial unshareable amount, the amount that they pay as a member, then they would be responsible for those payments.
Great. The next one is, does Zion meet the standard to avoid the fines levied by the IRS for not meeting the individual mandate if it is ever brought back?
No, so Zion Health is not a what we call a exempt membership program, and so the ACA does not put Zion Health as one of those carriers or health sharing organizations that's exempt from the ACA.
Okay.
So
Is Zion available in all states?
it is. We don't have any states that we're restricted from medical cost sharing organizations. We're not restricted on any of the states.
Okay. Um, can we see what the Zion email says once it is sent to a patient? Specifically, I'm interested in using it as an invitation rather than something to send only if they have already expressed interest. That's a great question. I've just pulled it up, so let me share my screen. Um, I'm not sure it would be the best case to send it as an invitation, because as you'll see, the subject line is action required, finish setting up your Zion Health membership. However, there is a lot of good information in here. And if you ever wanted to send it to yourself, you can always just go through the flow yourself and then send it to yourself. One of the great things that you can do now is we have a custom email feature in Hint. So what you can do is copy and paste some of this information and kind of format it like, we invite you, this is a new thing we're offering, and copy and paste that into the custom email feature in Hint. If there's interest in that, like if someone enters a question in the Q&A, I can go over how to do that, but I don't want to use up too much time just doing demos. But this is the email. So you'll see that it talks about who are we, this is what Zion Health believes, these are the benefits, how does it work, how do I join? And then this is a link that is unique to each person. So when you copy and paste this, you just have to understand that this link is not going to be accurate. You need to tell them that to reply to the email essentially, and then when they reply, you'll receive that from your patient, and you'll go in like I showed you on the patient chart and click that send enrollment email. Then they'll receive this email and they'll log in. So I hope that answered your question, and I know it's a little bit of a workaround, but you definitely can do it from Hint to send a mass email inviting your patients to check out Zion. And just so you know, this is a staging email. So you'll see it says test@testing.com. That's not in the real email. So I don't want you to think that that is in the real email.
That's a good email address.
Okay. The next one is, for employer groups, do they have to open a bank account?
No, we do not require any bank accounts for any of our members, individual or group. It's all very simplified.
Great. Um, so it says, okay, this is a good question about the worksite membership being added to the DPC sign up. So right now we support, and Nathan, correct me if I'm wrong, we only support retail membership sign up. Is that accurate?
That's correct. We do only support that currently through the Hint platform as far as the integration, but we do have worksite memberships that we still do, and we're offering the DPC rate still. So that is something that we still have available, and we use the Hint platform still as well, but it's not it's not an integrated one-stop place. It would be they would need to enroll in your platform under your system, and then they'd need to enroll again with our platform essentially.
Great. Okay. How does Zion Health deal with a catastrophic event for a patient? Let's say an MI requiring a cath, etc.
I'm trying to hear all that. That was how is
So I'm reading verbatim. It just says, let's say an MI requiring a cath, etc. We are not doctors, so apologies.
sure
Yeah.
sure yeah. So the heart of the question specifically is how do we manage and share in large medical needs? I think is what we're asking, and we're equipped and we share in large medical needs on a regular basis now. And how we do it is just like any other medical need, small and large. We're working with the providers directly and working with you as a direct primary care provider and finding out what their recommended course of action is as far as their treatments. We have um, a team that would work with you as the provider and also work with the member so that we can help negotiate and understand what your needs are, and so that we can best fit those needs and help them. And so we pay those providers directly. I think that's part of the thing that helps make that process easy is when as those bills are coming in, cancer being a really common condition that's usually on the higher side as far as cost, and it's a lot of care, a lot of different services that they need from every angle. There's many different providers that's involved typically, and we're getting those medical needs. Of course, the members provided that ID card, made it simple so that the member doesn't have to play the billing game. It doesn't have to collect all the bills. All those bills are sent to us directly, so we're on top of those and negotiating those and paying those quickly and efficiently. And so
So what I'm
those,
hearing
go
from
ahead.
you, Nathan, is the patient would present their ID card, and that would give the provider or the hospital the ability to send the need directly to you guys rather than the member receiving the bill and being kind of on the spot about how it's going to be handled.
Right. Yes. Yeah, they're not checking out of the admissions at the hospital, getting a big bill and saying, "Hey, here's this, pay this all now." That's not the case. Members are encouraged to pay their IUA. That's their initial unshareable amount that to the provider. So if they're at the hospital and they're trying to check out, they could pay that to them or make arrangements to pay that to that provider. But the rest of it would be shared 100% with the community, and they're not having to pay those or play the billing game with the providers or with us. We're working directly with them.
Great. Okay, moving on. We have a couple more questions about employers. I'm going to table those questions for now, but here's a really good one, which is, what is the incentive for us to offer this to all of our members as opposed to referring them to a health sharing organization?
So this we are a health sharing organization. So that's a great question because we are that's exactly what we are. Um, what is the incentive to share with to refer those over to Zion Health is that we as Zion Health are working to prevent or to build your practice with you in a way that no other organization is, and we make the process simple. And so we find that practices that have worked with us in the past have been able to grow their membership a lot faster. we're able to provide better care for our members, our mutual members, so that they, at the end of the day, if when something happens, that you're there for them, we're there for them, and working together as a team to make that happen. And so that's some of the incentives, is that we of course are there to make that happen with you instead of against you, and we're working with you as the quarterback of the process. And of course, there's a lot of details that we can get into that we probably want to save for individual conversations. But if you have an interest in learning more about incentives and how we can help you, please feel free to reach out to us, and we'd be glad to do that.
And just to add around questions around, I've seen a few come in around, are there are there details around the membership fees, the insurable amount brackets? All of that is on the website, and I'm going to follow up to every person who's registered for this webinar with links to that. But if you go to zionhealth.org right now, you can also just poke around and find it there. Um, so that's a little cheat sheet there. Similar question for marketing materials for websites. So that's a great question. Is there anything that Zion has that the practices could just hand to a patient to give them some information?
Yes, yes, absolutely. At designhealth.org website /DPC, there's some specific documentation and resources that will be able to complement your practice and be something that you could either email to your patients or give or print up and give to them.
Great. On the same note of IUAs, also from Brianna Wilson, how many IUAs per year for individuals? Like, what is it, a yearly thing or is it per incident? Can you talk a little bit about more?
Yeah, that's a very good question, and I'm glad you brought it up. There's a cap on how many needs a member needs to pay. Let me rephrase that. There's a cap on how many IUAs, excuse me, that a member has to pay in a year in a 12-month rolling period. So there's three. So if a member has more than three, what would happen is we'd still share in those medical needs, but the member wouldn't have to meet that next IUA for that need. So three is the number, and it's a 12-month rolling period. And anything over $500 after that, as far as a member's need, would be shareable at 100%.
And what about for a family?
And that's the same for family, individuals or family, the same.
Great, thank you. Um, Going back to the member experience with specialists, do you ever have the situation where a specialist or hospital goes after the member for the difference between their charge and the rates your PPO network pays? I think there might be a little clarification needed there because it's not a PPO
Sure.
network.
Yeah, so the network doesn't pay anything, but what happens is we use the network for repricing, and the bills still come to Zion Health for sharing. And what we're referring to is balance billing. We don't have situations where there's balance billing because what we do is we work directly with the provider and we find out what those medical costs could be paid at, and we pay those providers directly, and it's paid off at that point. And so there's balance billing is not an issue that we have here.
Okay, I think David Cunningham, if that answers your question, then good. And if it doesn't, then you can drop another one in.
Yeah.
The next question is about um, bill negotiation. How do you negotiate bills?
Yeah, bills are, we've used several different tools in making sure that we're able to negotiate the expenses. And how we do it is we have a team of people, and again, I mentioned earlier, I come from an administration background, and I've been in this business of helping members with bills, medical bills, for a long time. And I've been able to help people with these bills with negotiations, and we've been using those same practices in Zion Health from the beginning. So members, when those bills come in, we're using several different proven and tried processes that make it so that we can negotiate those expenses down. And so working directly with those providers and negotiating those expenses is part of what we do, and we do a really good job with that. Our members are typically paying anywhere from or those costs, I should say, will anywhere from 25 to 60% of what the total bills typically are. So for every dollar that comes in as far as a bill goes, we're paying anywhere from 25 to 60 cents on that dollar. And so those negotiations are very strong and helpful for our members at all levels of expenses. So anywhere from small medical expense to large medical expenses, we're doing that day in, day out. And that's part of what we do.
Great. The next question is, are you a certified healthcare sharing ministry?
Yeah, that kind of goes back to that same question about ACA earlier. We're not a certified ACA approved health share as it would be. I know some states require for us to be a certified health share to void tax penalties for the ACA, and that's something that we're not. That requires health share to be in existence for many years longer than we have, and that's something that we're not meeting that requirement.
Great. Okay, I think we answered this one. Are the IUAs for each person in a family, or are they family totals? Can you
Yeah,
discuss?
so it's there's either way. So if you have a household, for every household where you're only responsible to up to 3 IUAs in a 12-month rolling period, regardless of how many members in that household. So if you have you and maybe you have a spouse and several kids, if each of you have an IUA that you'd pay, it's up to 3 that you'd have to pay as a member, and the rest of it would be shared with the community. So it's it makes that really simple. So you're not having to worry about a different or a different max if you have an individual membership versus a family membership.
Great. This question is, do you use networks?
Yeah, that would be the question back about the PHCS network. We do use PHCS network as a supplement tool, as a pre-negotiated rates, but it's not a requirement to use the network, but it is something that we do use.
Is there a time frame that you try to process cost sharing in? Say there is a surgery in June. How long does it normally take to resolve payment?
Well, that's one of the great things about Zion Health is that we're processing needs within 5 business days typically. So if you had a surgery back in June, we actually oftentimes like to pay for surgeries ahead of time. So if you know of a surgery coming up, what we'd like to do, of course, is coordinate with the direct primary care practice to make sure that we're getting the care that they need for the patient. But in addition to that, we're paying those providers that are performing those services, such as surgeries and so forth. We can pay for those ahead of time if needed or if we know about it. In many cases, we don't know about those medical needs until after the fact, in which we would, of course, gather all the information, negotiate expense, and pay the provider typically within 5 business days.
So this next question, going back to the worksite. So to be clear, is how you provide services, worksite is how you provide services to employers. Is there a way for brokers to offer?
Yes, so brokers could be involved in the process as well. Absolutely, and we can support many different platforms and services to make it easy for brokers that are working with your practice on a large or small basis, and we have a lot of tools. And so I'd encourage you, if you have those situations where you're working with a broker, you're working with groups, please reach out to us. We can make that really easy for your practice and engaging in those relationships and making it so that you can win more cases and help more people out.
Great. The next one is, can you give a reference of a practice that has grown faster because you co-marketed? And do you have a budget for co-marketing?
So we have had a lot of practices that have grown. I haven't been given permission to let everybody know who all the practices out there that work with us. But the practices, there's many of them that do. And if you have any, I don't feel it'd be a good idea to publicize everybody's give everyone's cell phone number and do those things. But if you have somebody that we could do that more on a one-on-one basis, and so please reach out. We could We of course need to gather permission from some of the practices that have had success with us, and get them connected with you. But there's actually a lot of information even on the websites of different practices. If you look at our social media, and if you look at the even if you were to Google Zion Health and DPC, you would find there's a lot of practices that uh, give us great reviews and of working with us, and you could see that they're finding success in it too.
Great. Um,
I
one
feel like
last
there's a
question.
second part of the question. Is there? I forgot what it was. Already.
It
Was there
was about
another?
co-marketing. Do you have budget for co-marketing? How do you promote the DPCs that offer Zion?
Yeah, so there is ways for co-marketing to be there. We provide a lot of materials, and we also have the ability to do a co-branded landing page for your members to learn more about Zion Health and your practice. And so if you have any need for those co-branded websites or marketing materials or anything that we could help you out with, if you have even if it's a great idea that you think you would like us to help you with, please feel free to reach out to us, and we'd be glad to do that. We had a DPC that wanted me to come out, for example, and do an annual. Um, we had a couple of DPCs that have done this recently that wanted us to come out and do a presentation with their practice for their annual event. And so I had a trip planned to go and see them, for example, on one of them, and the COVID-19 thing happened, and we had to cancel our flights. But we've done it for a few different DPCs in the past, and we'd love to help people and find ways to help them. So if there's anything that you have specific needs for, feel free to reach out, and we'd be glad to help you out.
Great. Okay, one last question about negotiation. What happens if a provider or hospital refuses to negotiate the bills? I practice south of Boston, and we have some of the most expensive hospitals in the country.
Yeah, that happens. That's something that partly what makes us really unique in the process is that we've been working with providers all over the country for a long time, and we know how to negotiate those medical expenses. Some of the providers are more difficult to work with than others, and we have a number of resources and solutions to help negotiate those expenses, and we find ways to do that. And we've had great success in sharing those medical needs. So even to the tough places like you're talking about, the most expensive hospitals or the hospitals or facilities that are difficult to work with, we're still able to do that, and we're not shy about being advocates for our members.
Great. There are quite a few questions that I'll just consolidate into one about becoming a broker for Zion and what that experience is like. Do you want to answer any of those, or do we want to stick to DPC and follow up individually?
Those, yeah, there's a lot of information that we could get into. I think we could go. There could be a lot of questions on that, and I don't know if we want to spend the whole time on that, but I do want to mention how you can learn more about becoming a broker or an affiliate, as we call it, with Zion Health. And we have an easy process. You could reach out to us and let us know that you want to become an affiliate, and we can help you through that process of education, and help you through getting set up so that you can have a successful program with Zion Health.
Great. And some of you asked that question anonymously. If you wanted to ask it non-anonymously, then I can make sure that you're followed up with. Otherwise, you can just go through the channel of going on Zion and filling out the form. So just a little plug
Sure.
there. Um, okay. So options for the employees of DPC practices. Are they able to provide Zion as benefits for their own employees?
Absolutely. Yes, absolutely. Um, you're able to set up a worksite membership if you like to for all your employees and team, and being a member of your DPC would allow them to participate in those DPC rates for Zion Health as well.
Great.
So not a problem. We love that.
Awesome. How long has Zion been in existence?
So Zion Health was formed in the late 2018. So we're relatively new, and we're really proud of that because uh, when we were formed and put together, we've been growing very quickly. Uh, to date, we've grown faster than any other health sharing organization, and we have really great success with working with providers and working with members, and we've found a lot of great success in helping other people out. So yeah, we're new, and we're proud of it.
Do you have any case studies or examples you can share, either via email or otherwise, he's asked, regarding success stories of members who have used Zion?
Yeah, there's been lots of examples. Every day we're working on member needs and paying out on expenses. So that's every day there's stories of people who've experienced this. I know that we have, of course, reviews online through third-party websites that people are sharing them themselves, of people who've gone through the experience. And of course, not everybody that is sharing in medical expenses with us are posting reviews on websites and documenting that online. But we do have a lot of stories and a lot of situations that we could share. Uh, I wanted to point you to the reviews because that's people are telling the reviews on websites, which is great. Love for people to continue to give us feedback and share with us. But the other thing is, I guess if you're wanting some specific stories, we have a couple different stories I could share with you. One of which is about our additional giving fund. I mentioned earlier we have a fund that's designed for people who have needs that are outside the normal situation. So this is a situation where a member had a need that was obviously a pre-existing condition, and they signed up with us. And a few months later, they brought to us a situation where they have been this member's the child. It was a boy of around, I think, 15 years old, and he's been suffering with some situations with his feet for a long time, and it was getting to the point where it was very painful for him, and it was not something that it was going to be good for him to continue with, and it needed to be fixed. And so they came to us and asked for help. And so what we did is we set up a negotiation with a provider that they were able to work with, and it needed a specialist, so they got set up with them. We coordinated the payment, and we helped them. And so they had to do 1 foot at a time, and it took them a little while to get it all situated. But now the boy is able to walk like a regular person without pain. And so that story to me is a good example of why the additional giving fund is there. This person needed some help, and we were there to help them.
Great. Um, so someone said, are preventative tests such as mammograms, PAPs, and colonoscopies covered without any IUA expenses?
That's a great question. We have two different DPC memberships that are available. One membership is our, and of course we recognize that all DPCs are different, and your needs for your members might be a little bit different as well. One membership would allow you to be able to have members join without preventative services on there, and the other membership would include preventative services, and that'd be what we call our connected health program. And so the connected program allows for sharing of those preventive services such as colonoscopies, mammograms, and immunizations and other things without having a IUA met. So there's no initial responsibility from the member. They just pay $0, and we would pay for those members' preventive services directly. And there's no waiting period, and those are great programs. So I'd encourage you to look at that and see if that's right for your practice.
One question is around pregnancy. Can you talk about the sharing limitations involved with pregnancy and that whole process?
Yeah, love the concept of pregnancy. We've helped a lot of families who are looking to expand and have babies, and we've been able to help people with those newborns on a regular basis. And so the we have actually a guide that is very useful in talking about maternity. And so if you go to our website, you can learn there, you look for maternity guide, and the maternity guide goes through and gives very detailed information on how to share with Zion Health when you're looking to expand your family. And so all those questions and more that you haven't asked yet are all addressed in that guide.
Okay, and I'll make a note to include that in our follow-up email so that you'll get the follow-up email tomorrow, and that'll have a link to the maternity
Perfect.
guide. Um, One more question about employer rates. Are employer rates different than individual rates?
So there is benefits to having the what we call our worksite rates. They're a single tier rate where so you're not having to worry about age banding. It's just one age for everybody on the work site. If you are individuals, that we have an under 50 and over 50 rate that's available. So that's the only difference is that you just have one age tier instead of two.
Great. Well, that's all the questions that we have. I don't see any more coming in. So if you have any last minute questions, now is the time to drop them in. I really want to thank you again for joining us this evening. Might be a little bit later for many of you than it is for me. So I really appreciate you spending your evening hours with us. Um, like I mentioned, there's going to be a follow-up email. Oh, one more came in just under the wire. Um, what about 65 plus?
So our sharing program is designed for those who are under 65. So we do not currently share in members who are over 65.
Okay.
We're not designed to, and it, just to add one more thought is we're not designed to replace Medicare in that program. So that's the answer.
Uh, all right. So with that, I'm going to just let everyone know that I am going to be sending out an email tomorrow that includes the recording. It'll also include some resources about Zion, some that we touched on tonight, and some that we haven't. And any more questions, you can always reach out to the Zion Health team. I'm sure that if you go on their website, you'll see there's actually like a chat bubble there. So I'm sure that they'll be willing to answer your questions uh, that you have. And with that, I'm going to close out the webinar. Thank you all for joining.
Thank you.